If you're a man looking in the mirror and thinking, I don't look bad, but I don't look like myself anymore, this is where I stop and pay attention. Because what most people miss is how male faces actually age, why standard aesthetic treatments often fail men, and why things like structure, hormones, weight changes, and skin quality matter far more than simply chasing wrinkles. I've seen the same pattern repeat itself over many years in practice. And when it's ignored early, people often end up compensating later with more filler, more procedures, and results that feel less and less natural. Today I want to walk you through what I see going wrong in male facial rejuvenation and what I do differently now. If you're new here, I'm Dr. Fred Bloem. I practice integrative, holistic, and aesthetic medicine, and my work lives at the intersection of anatomy, biology, hormones, and long-term facial health. This channel isn't about doing more procedures, it's about thinking more clearly. If that resonates with you, take a moment to like this video, subscribe to the channel, and join my newsletter if you want deeper, longer form education beyond social media. One of the biggest mistakes I see is treating male faces like slightly modified female faces. Men age differently. Bone loss tends to occur earlier and more aggressively. Fat pads behave differently. Skin is thicker but collapses structurally, and hormones play a much larger architectural role.
Men lose structure first, not softness.
So when we apply soft, feminizing techniques or overuse neurotoxins, we don't actually rejuvenate men. We make them look off. And men sense this instinctively. That's why they often say, just don't make me look weird. That's not vanity, that's identity. One of the most important and misunderstood concepts in facial aesthetics is the ogee curve. The ogee curve is the natural S-shaped contour of the face. It's created by the relationship between bone, fat, skin, and light. It runs from the lateral cheekbone gently inward beneath the eye and then outward again toward the lower cheek. When that transition of light and shadow is smooth, the face looks rested and supported. When it collapses, the face looks tired, even without wrinkles. And when it's overbuilt, the face starts to look puffy or unnatural. This is where male and female faces must be treated differently. In women, a softer and slightly more medial ogee curve can look attractive. In men, the ogee curve should remain flatter, more lateral, and more structural. Too much medial projection in a man's face quickly feminizes it. When I assess the ogee curve in consultation, I'm not thinking about filler yet. I'm thinking about structure, biology, and light. The first thing I do is look at the face at rest. Not smiling, not posing, just neutral. I'm asking myself where light reflects naturally, where that reflection breaks, and where the face flattens and where it collapses. A healthy ogee curve flows. A disrupted one tells a story. Next, I look at the face from oblique and profile views because straight-on views often lie. The ogee curve reveals itself when someone turns their head slightly, when they're talking naturally, and when the face is seen in motion. That's where you start to notice loss of lateral support, overfilled medial cheeks, and early structural collapse. When someone looks okay straight on, but distorted when they move, something isn't right. Then I ask a critical question. Is this volume loss or is this structural loss? Not all ogee curve loss is caused by fat loss. Sometimes it's bone remodeling, ligament laxity, skin thinning, and overall tissue quality decline. If you treat structural loss with soft volume, you don't get lift, you get puffiness. And finally, I always assess sex-specific anatomy. Men should not be treated with the same ogee targets as women. In men, I'm aiming for less medial fullness, more lateral support, straighter transitions, and preserved angularity. That's how you rejuvenate without erasing identity. As we age, the face doesn't just develop wrinkles, the architecture changes. Bone slowly resorbs, ligaments weaken, fat pads descend or deflate, and skin thins and loses elasticity. The ogee curve doesn't disappear, it collapses. That collapse is why people often look tired even when they're sleeping well and taking care of themselves. Chasing lines alone misses the real issue. Weight loss adds another layer to this, especially rapid or significant weight loss, which we're seeing much more often now. Facial fat disappears faster than skin can adapt. The midface flattens. The light transition breaks. That's why people often say, I feel healthier, but my face looks older. The answer is not to overfill. The answer is restoring lateral support, improving skin quality, sequencing treatments properly, and respecting facial tension lines. Overcorrecting weight loss faces is how the pillow look happens. Hormones quietly influence all of this. They control bone density, collagen production, fat distribution, skin thickness, healing response, and long-term tissue behavior. In men, low testosterone accelerates bone loss, flattens the midface, weakens jawlines, and thins the skin. Chronically elevated cortisol worsens tissue breakdown and deflation. In women, estrogen decline reduces collagen and flattens the ogee curve, while insulin resistance often causes puffiness without structure. This is why purely aesthetic treatments often don't hold. The biology underneath isn't supported. That's also why I integrate bioidentical hormones when appropriate. When hormones are optimized thoughtfully, skin quality improves, structural treatments last longer, less filler is needed, and faces age more slowly and more naturally. In selected patients, peptides can also support collagen synthesis, tissue repair, inflammation control, and recovery after procedures. At that point, aesthetics stop fighting biology and start working with it. What I do differently today is simple, but it's not easy. I treat skin first, respect male anatomy, use less product rather than more, sequence treatments carefully, address hormones and metabolism, and focus on long-term facial integrity. The goal isn't to look done. The goal is to look healthy, strong, and congruent with who you are. If this perspective helps you think about facial aging differently, please like this video, subscribe to the channel, and consider joining my newsletter for deeper integrative education. And I'd love to hear from you in the comments. Has anyone ever explained facial aging to you this way? Have you noticed changes in your face after weight loss or hormone shifts? And would you like a deeper breakdown of male versus female facial structure next? Drop your thoughts below. I read them.